So Ryan's going to start.
All right. So as we move to the first slide, the first slide is just what is cancer in the first place. So the entire body that you have is made up of over 1 trillion cells, and each cell grows, divides, dies off naturally in like a normal rhythm. Sometimes these cells actually mutate, and they'll actually start to grow and divide faster than normal. And this is what we kind of constitute as cancer, is cells that are kind of growing and dividing without the normal rules of how fast they should be growing. Now, cancer cells also rarely die, so they'll actually clump together into what we call tumors. And you'll probably hear the word tumor a lot when you're talking about cancer. And these tumors can actually start to interfere with normal body functions depending on where they are. And that examples can be like if it's a lung tumor, they can start to interfere with breathing. If it's a brain tumor, it can start to press on the brain and interfere there as well. And then some of these cells can actually break off and travel to other areas throughout the body and create even, other cancers in multiple areas. Now, since your entire body is made up of these cells, cancer can essentially start almost anywhere. Some areas are more likely than others, but really, this is why we have over like 100 different cancer types. So it can get a little complicated when it comes to treatment because each cancer can actually have a different style of treatment. And on a picture on the right, if the video isn't already obstructing it a little bit, kind of shows how these cells kind of grow and divide and take over the area that they are in. So if we want to move on to the next slide. Now, how do people get cancer? So on a base level, we are all born with genes that kind of regulate how our bodies grow. And sometimes these genes can actually set like a base bar of how likely you are to get cancer. And for everybody, that's a little bit different. And largely, these are inherited from our parents. And then sometimes our genes can randomly change to make cancer more or less likely. Now, these are things we can't change, like I said. So some things we can change are behaviors that I actually have included a little photo on the right that shows the amount of deaths per year that can actually be prevented through behavior changes. And right at the top is smoking and tobacco use. Now, smoking and tobacco use along with alcohol use can largely increase cancer along with the second rate there, which is obesity. And along with obesity can be lack of physical activity. So people that are obese are already, if we're learning a little bit during this crisis right now, is that people who are obese tend to be a little bit more compromised with their immune systems. And it makes it more likely for cancer to be able to develop unregulated. Also, sun exposure. Number 3 right there at UV radiation. So UV rays are what come out of the sun, and when it hits your body, it can penetrate and actually change the way that our cells behave. And one of the best ways we can prevent that is using sunscreen. So push it on your entire family to use sunscreen every time you go outside. It should be a habit that we all should really develop. And interestingly, viruses I have on there, when you get sick, sometimes those viruses can actually change the way your body regulates cells. And one of the best ways to avoid getting new viruses is to stay up on all your vaccinations, try to, as we're learning right now as well, not maybe shake everybody's hands and try to cough into your shoulder so you don't spread viruses. So important stuff. And on the slide, the picture, it says too little fiber. What that's actually talking about is like fiber in food. I know they spell it differently in the UK, but what they found is that fiber in the diet actually decreases intestinal cancer. I was looking into it, and they kind of have an idea of why that might be, but at this time, I'm not going to say exactly how that does not cause cancer. All right. Moving on to the next one. So medical phrases that you might hear pretty often when you're discussing cancer. So one of the big ones is metastasis. That is the word we use when we're discussing the spread of cancer throughout the body. So a lot of times, and this will go when I get to the stages section, a lot of times when a cancer grows, a little bit can break off, move around the body, and take residence up in a new place in the body and start a whole new set of cancer right there. And that's what we call metastasis. Now, the difference between a benign and malignant tumor is benign tumors technically are not cancer. They grow a little slower. They do not spread throughout the body, so they do not metastasize. And they don't necessarily invade other parts of the bodies. Like essentially a good example would be sometimes there are brain tumors that will grow slowly and press on the brain a little bit, but they're not necessarily spreading, and they don't kill as often as malignant tumors do. Also, we have remission. Remission is talked about a lot as the goal of treatment, and oftentimes remission just simply means that there are no signs and symptoms of the cancer. This does not mean that the cancer has been cured. A lot of times treatment goals are to get the amount of cancer cells down to a limit that doesn't interfere with the body too much, and then people will maybe continue drug treatment to keep the cells at that small amount. But essentially that does not mean that the cancer is gone. So you technically still have cancer, but it is so small that it does not affect you. Biopsies are what doctors will actually do. They will go in, they'll take a small piece of the tissue, and they can actually test it to tell you if it is a malignant or benign tumor. And then prognosis is a word in which doctors use to kind of define what they expect the disease to look like for each individual. Everybody's prognosis is different, and if two people have the exact same type of cancer, that does not mean that their prognosis is exactly the same. It can be different from person to person. And lastly, with stages, stages get a little bit complicated when you really dive into it, but generally they go from stage 1, which is the least developed, to stage 4, which is the most developed cancer. And what that generally means is they base that on the size of the cancer, how much it has invaded into tissues around it, and then if it has metastasized or moved to a different part of the body or not. Stage 4 means that it is usually a large cancer, it has invaded a large part of the body, and it has metastasized a lot. And generally we will focus on treatments based on which stage you are in. Okay.
All right, so I wanted to talk a little bit more about treatments and sort of the whole difficulty of really that phrasing. I know Ryan, of the phrasing a cure. So I know Ryan touched on this a little bit with talking about how the goal for cancer treatment really is remission as opposed to like curing it, because there is always a chance that the cancer cells can come back. But there's some other reasons why treatments are so varied, and there's really not going to be one specific cure for cancer. So I wanted to play this video. It's really short. It doesn't have any sound, by the way. All right, so that was that video. So it just kind of gave you guys an idea of sort of the wide spanning range of different types of cancers and how each treatment goal and treatment will vary per patient. So let's talk about a few of those treatments. So as we discussed, the treatment for cancer is different depending on the person, type and stage of cancer, and many other factors, including patients' own preferences. So some patients might not want to use surgery, or they might not want to use chemotherapy to treat their cancer. And doctors and like the medical care team will really try hard to incorporate those preferences into their treatment that they develop. And I'll show you guys a video about that next. But some common treatments for cancer include chemotherapy. So that means using chemicals and special medications that can kill cancer cells. So in chemotherapy, these medications basically target really rapidly dividing or uncontrollably growing cells. And so that's why they're really efficient in killing those cancer cells, because like Ryan said, cancer cells are usually the ones that are growing uncontrollably. That's also sometimes why they might kill other types of cells, which is why a lot of the times if you see like chemotherapy patients, they might have decided to like shave their head because some of them will lose hair and other things like that. With surgery, using surgery is another common technique to remove tumors. So basically, doctors will go in and they'll look at a picture of the cancer and they'll see, hey, where do we see this tumor? Where can we most efficiently remove the most of the tumor as we can without causing too many side effects to the patient? So surgery is also a really common treatment, and a lot of the times doctors will perform surgery after chemotherapy has already reduced the number of cancer cells in the body. Then they'll use surgery to remove any like visible tumors. Immunotherapy is actually teaching your body's immune system, which is what normally protects you when you have like a cold or the flu. It teaches it how to kill cancer cells. So you guys can kind of see this in the picture to the bottom right. Sometimes your body's immune system doesn't know that cancer cells are bad because they are technically cells just like every other cell in your body. They're just really uncontrollably dividing. And so immunotherapy can basically teach the cells of your body's immune system that cancer cells are bad and that they should be attacked. And so then your immune system actually does a lot of the work in attacking and killing the cancer cells. And then there's also two other sort of unique treatments. There's cryoablation, which is actually using cold to freeze cancer cells. So how this works is usually a needle is injected into like a tumor, and some basically freezing medication or treatment is applied to the cancer cells, which will effectively kill them by freezing them. The opposite is radiofrequency ablation, which is using heat to burn the cancer cells. So your own cells would react similarly, so they could also freeze or burn, but since it's really, really targeted, then they're only targeting the tumor cells or the cancer cells in the body. So like I said, there's another, I wanted to show you guys this story of a girl who had cancer. And so the primary treatment actually for this cancer was going to be amputation, but she really didn't want that. And so she found doctors that were willing to work with her.
My name is Julian Mason. I'm 11 years old, and I was diagnosed with a tumor at the age of 9.
She came home, and her ankle was swollen. And I said, oh, what happened? She said, oh, I fell.
After a week later, I told my mom it was still hurting really bad.
So the swelling didn't go down, and the physician advised us to see an expert. The first option was amputation.
I was like, what's amputated? And she says, when you don't have your ankle no more, when they just cut it off.
It was just a matter of finding the right surgeon that could do the surgery she needed, a limb-sparing surgery.
My mom started looking at doctors, and then that's how she found Dr. Morris.
Amputation did not resonate with them, and that she would have genuinely been unhappy if she had at least tried this first.
I want to try to save my leg first before I get amputated.
The most nuanced part, I think, of what we do is matching the right operation with the right patient. There are lots of options out there, and all of those options probably will work fairly well. But if the patient doesn't want the option, then it doesn't work at all.
38 staples all the way up, because I was really interested how many staples I had. When my mom finally found Dr. Morris, it was the best thing that ever happened to me, like a doctor who could actually do this type of surgery on my ankle to save my leg. It was like a really good blessing.
By far, the most important thing is to get rid of the tumor. So we took out over 50% of the tibia bone, including all the way down to the ankle joint. We took the smaller bone in the leg, the fibula, transferred it over to where the tibia used to be, connected the remaining tibia down to the bone in her ankle called the talus. So what we essentially did is we rebuilt the leg by fusing her ankle.
It was very difficult surgery, but she made it so comfortable for me and my daughter. What really stands out is my daughter did not experience any tremendous pain after the surgery.
I'm glad that I'll be able to walk because like now when I'm walking, it feels like a normal foot. And like I'm practicing on being able to like stand on one leg again. I love to dance. I'm a self-taught, so I just love to do that like almost every day. And my big inspiration was Michael Jackson when he used to dance. Michael Jackson.
So yeah, I just really like that story because I thought that they did a really great job keeping the patient in mind during the treatment the entire sort of way through. All right, so we're gonna move on to Alex.
Hello. Okay, so cancer. It can be a really scary and challenging word just to hear. So to be dealing with something like cancer, it's definitely going to be difficult and kind of scary. But there are some things that we can do if we ourselves are experiencing it, or know someone else who is, to help make sense of it. And so cancer can have its own language, basically. It kind of has its own terms, and it can be really hard to just have a sense of what to do or what's happening. So it's important to remember that we can turn to people like doctors and nurses to help us like understand or make sense of something that's just really difficult to kind of wrap our heads around. And what can also help you make sense of it is if you do your own research. So you can do your own reading, but it's important to do so with sites that are credible and trusted. And so two that are really good sites are cancer.org, which is a part of the American Cancer Society, and kidshealth.org is a really great site too, that has things in a more like more understandable and easy to digest format for younger people, so for kids and teens who are just trying to make sense of what is cancer and what's happening. And it can also help to make sense of it if you share what you are going through, or you try to learn what someone who has cancer is also going through. And so there are things like support groups and online forums and places like the hospital or treatment centers. They can provide you with those sources that you can turn to. And the next thing that we can do to help deal with cancer is to first and foremost take care of our physical health. So when someone has cancer, they typically have a specially trained team of different types of professionals that are going to help them get through their cancer. And so specifically what someone could have is what you would call a nutrition specialist. And they basically can help those who are going through cancer eat right. And it's important that we eat right, so that we eat enough and that we eat the right things so that we can be strong and we can kind of get through these treatments that actually can be pretty tough, like on our body. And just how Christina had brought up about our immune system, which helps us fight diseases. It's important that we maintain our nutrition so that we can get through the challenges that can be put on our body when going through cancer. And something else that is important is physical activity, so exercise. So just as when we are well, it is important that we maintain our physical activity when we are going through cancer. And it may not be right for everyone, and definitely your treatment team will let you know. But people that are called physical therapists, they can help you find the right exercise, and they can even let you know if that's something that is appropriate for you in going through your cancer. And another thing that is important for us to help us deal with cancer is to manage our emotional health. And so it's definitely natural to experience tough feelings such as being angry, being anxious, being scared. And even if it's not yourself that's going through cancer, if it's like a family, if it's a family member, or if it's a friend, you will naturally be experiencing these really tough feelings. And so on that note, it's important to not just keep it inside, but to talk to someone. And so there are people that you can do that with. So if it's not with your parent or with another trusted adult, there are professionals that can help you talk through those emotions, because it's better to just let it out rather than keep it inside, which can actually be more harmful. And okay, so next slide. And so how can I help people with cancer? So first and foremost, the most important thing that you can do is just to be yourself. Something that often happens is when someone has cancer, or they themselves or someone that they know, one of the things that they often mention is that people will start to act differently towards them. And so it's important that you just stay true to who you are, because that person, they are not changed by their cancer. They are still the same person that you loved and knew before their cancer. And so, but in order for you to be there for them, it is important that you take care of yourself as well. And so if you do need help or do need to talk to someone, it is important that you get that done so that you can be there for that person. And then some other things that you can do are to keep in touch and to be present. And there are a number of ways that you can go about getting that done. For those who are in the youth group, would someone like to just say if they have some thoughts on how they can be present for someone who has cancer?
Okay, Mount Zion Youth, you can unmute yourself if you want to and share your thoughts on how you think you can be present or helpful for someone who's going through cancer.
This is Kennedy. I guess you could make sure that your hands and stuff are clean. You want to be full of germs or anything, and then you can bring them cards, maybe an edible arrangement, stuff that you know is like good for their body so they don't get sick.
Definitely, that is awesome. That is such a wonderful thought. Thank you. Yeah, you actually brought up a very important topic. And so as we were talking about the immune system, so people who are undergoing treatment for cancer, the drugs that they may have to take, that can kind of make their immune system weaker. So it's important, if we are in contact with these people, and I know it's really hard now because of social distancing, and with the virus, we have to maintain our distance. But definitely for those who are going through treatment, because their immune system could be lowered. But yeah, so hand hygiene is of most importance. And so that was great that you touched on that. And some other things that we can do is, and then of course, like once it's safe to do so, we can do those hospital or like home visits. We can check in with them through social media. We can send cards. You can just have a basic like phone call. But it's just important to, in the best way that you can, just check in with them and let them know that you are there. And then on top of that, you can offer help, which we will go on to in the next slide. And I'll definitely ask y'all's thoughts on how we can do that. And so when we are supporting someone, it may be hard to know what is the right thing to to say or even to speak at all, because it's just a really tough thing to just know how to navigate through. But just from what I've read and what others have said, it's much better to actually just say, I don't know what to say, rather than to just be scared of saying the wrong thing and not reach out. Because you being there in any way is going to mean a world of a difference to those who are going through this really tough time. And so to go back and see if y'all would like to participate some more, what I was going to ask is if you all know of some examples of things that you can say.
This is Shalonda. I sometimes, like you said, it is hard to say. You can say, I'm praying for you. Do you have special prayer requests? Because they may have something they're going through that they want a special prayer about. So that's what I would say.
Definitely. Yeah, like during like any sort of tough time, to like try to bring in that spiritual aspect, like that definitely is like gonna strengthen that person, then lift them up like during a time that can be really, really hard. So on top of what Dr. Horton had said, just some things that you can say are, I am here for you, or I care about you, or I admire your strength. Or even if you kind of don't want to go that route and just want to have just a natural or like just a more relaxed like conversation, if there's a show or a movie that y'all have an interest in, then you can just ask about that. Just honestly, just being there. So you can even just sit in silence. That too can make just make a great influence on that person. So we can go on to the next slide. And so apart from talking with them and giving them that support through your communication, there are some things that we can do to help. And once more, if y'all would like to just chime in and then see if there are some things that you can think of on how you can help support someone who is going through cancer.
This is Madison. You can ask them if there's anything that they need.
Great. Yeah, definitely. Like during a time such as this, it can be really hard to even do like basic things like around their home. And so if you just say like, I'm there for you, like what do you need? That like in itself is like is wonderful. So thank you, Madison. And let's see. So for the examples that we have, so on top of just asking what you can help with, you can cook something for them. You can offer to do like certain chores. You can just plan a day to just like hang out with them. If you know that they like a certain movie or a certain show, you can definitely plan on doing that. And of course, this is keeping in mind the whole situation that we're in now, where it's kind of hard to be in close contact with people. But hopefully once we get past this and those kind of socially distant measures are less in place, then we can kind of be more in contact. But there's certainly like other things that you can do, like if you cook things for them, you can just kind of leave it on their doorstep. Or you can even get on through like a video chat and you both can watch a show or just have a conversation. So there's definitely like what you all have brought up and what is on the slide. There are certainly lots of different things that you can do to just show them that you are there and you want to encourage them during this really challenging time.
So we've got a quick Kahoot. I know we're running a little bit late, but if you guys wanted to join us, I will put the code up for you all. We have it. One sec. Not my desktop. Where's my Google Chrome? Why isn't this popping up? 1 second, sorry. Let me try this again.
So if you've never used a Kahoot before, all you got to do is sign in to or plug in the website to your phone or computer, and then we will throw a code up that will let you log in, and we can all do this together.
There you go. It should be up. Can you all see it? Yay, hooray. I'm happy to see people joining.
Yes.
All right, I'll wait another minute or so and then we'll get started. I'm glad to see so many of y'all are joining us.
Yeah. Brian's stash is there too.
Yes.
Oh my God. Ryan's.
All right. So we'll go ahead and get started. I don't want to keep y'all too long. So, all right. So there's 5 questions. And there might be one answer or more than one answer. So if you think that you're seeing multiple right answers, you're probably right. All right, good job, you guys. So that was based on sort of Ryan's first couple slides that he showed you guys the risks. So great job. All right, so good job, Maddie and Kavya and Sandra and Reverend Horton and Kennedy. Very nice, good job. So you definitely can't catch cancer from someone else who has it. So keep that in mind when you're interacting with friends and family who might have cancer. There's no need to, I mean, for right now, during obviously COVID-19, we are following the social distancing guidelines. But after that, really the cancer patient, if they're undergoing like chemotherapy, they might have to keep a little bit of distance from you for their health. But there's no risk of catching cancer from someone who has it. All right, great job, you guys. All right, great job. So that was kind of in that treatment section. The treatment will differ per cancer and by stage and by where the cancer might be located. And so there's definitely different treatments that will depend a lot on just the individual patient. Great job. All right. So this time you guys can select multiple answers. Very nice. So actually all these answers were correct. These are all great ways to help people dealing with cancer. So making sure that they're getting the right food to eat, talking to doctors and nurses to better understand what they're going through, talking to a counselor to help deal with those really tough feelings, and then also talking to a physical therapist to see if they should or shouldn't be exercising and how much they should be exercising. Great job, y'all. All right, this is the last question. So very nice. Y'all are actually all these were right. So that definitely being yourself, remembering that they're still the same person that you know and love, being there for them, even if it just means sitting with them or even if you don't necessarily know what to say, just making sure that you're there for them. Keeping in touch with them. I know in this time of social distancing, it can be a little bit more difficult, but doing things like Zoom chatting or FaceTiming, or even just a phone call or a text can help remind them that you care. And then also that offering practical help. So maybe starting like a meal train or doing yard work to help them with that can all be really, really helpful. All right, great job, you guys. Y'all did awesome. So Ryan Stash got third. Then I think that's Kayla. Good job.
Kayla, yeah.
And first was
Fabia.
I am Ryan Stash. Just wanted to let y'all know.
Oh,
and Ryan
good
21.
job, Abby.
So thanks y'all for playing. I hope that you guys liked our Kahoot. But yeah. So I hope that you guys, I had a question slide and a references slide, but before I do that, just thanks y'all for your attention and your participation. And does anyone have any questions for us that they'd like to ask?
Any questions from the Mount Zion youth for the nursing group here? Well, if you think of one while I'm talking, feel free to interrupt. I do want to emphasize there was one slide they talked about sun and how you should wear sunscreen. And many times I run into people of color and they're like, oh, my melanin will protect me. But you still need to wear sunscreen. Black people, wear sunscreen. You tell them Sister Horton said so. Because you want to decrease the amount of exposure over time, and you need to make sure you reapply it. And I just say that because we're going into the summer months, and as they start reopening more and we get to go outside more, I want to make sure you do wear some kind of sunscreen. All right, so I'm going to leave a few more seconds for questions.
Since we're on the topic of sunscreen, the only other thing I want to mention about sunscreen is that usually after you apply it, it usually takes at least 20 minutes before it actually starts working. I often see people applying it out when they've been out in the sun, and while that will offer them some protection, it does take at least 20-25 minutes for the sunscreen to start working. So you can apply it before you go out into the sun if you know you're going to be when you're going to be out, and that way you have protection as soon as you hit the outdoors.
Maddie, did you have a question?
Yes. How do doctors know that the chemo is working when they're going through the process?
Good question.
I can talk about that a little bit. So a lot of the times the way that your cancer will be diagnosed is through, it could be like blood tests, like let's say you maybe have like a cancer that would spread through the blood. Then they could do blood tests or like a what's called a biopsy. I don't know if you remember that from Ryan's portion of the presentation, but it's where they take like a sample of tissue or fluid from basically where they believe the location of the tumor to be. And that can, a lot of the times when they examine what they take from the tumor, they can see if there's, what types of cells are in it. So there's usually if you have cancer, there's going to be some sort of mix of your body's cells and then also cancer cells. The goal is what we want to see in remission. We want to see basically no cancer cells or a vastly decreased number of cancer cells compared to normal body cells when we take those samples again. Does anyone else have anything to add?
Now I was going to add, thank you, Christina, that's good too. And you can also tell if it's working, is if it's a tumor, you'll see it shrinking, so it'll get smaller. And then Christina's correct that they can do like blood work to see if the number of cancer cells have actually decreased that are circulating through there. That was good, thank you.
Thank you.
Yeah.
All right, well, thank you so much. We'll get these posted on the Health Ministry website. And I didn't check my email, but Dr. Chavez, if you've already sent the final slides, okay, then I'll take care of that. Reverend Horton, are you still on here?
Yes, I am.
I'm going to let you say parting words.
Sure, you bet. Dr. Chavez, and to all of the students, thank you so much from the bottom of our hearts for taking the time with us this month to share this information and to impart your wisdom. We know that it was hard work, and we are just so grateful for what you've done. And although we can't be with you in person, please know that we're praying for you as you continue your studies, and you'll never know the impact that you're having on our young people and on the adults who have been in your class this month. So thank you so much for what you've done, and we absolutely wish you the very best. And if there's anything we can do to help you, don't hesitate to let us know.
Thank you.
Thank you.
Thank
you,
you,
Reverend
Horton.
Thank you.
Thank you. Thank you, Reverend Horton. Mount Zion Youth, please give them a round of applause or thank you. And then we are dismissed. So thank y'all.
Thank you, guys.
Thank you all. Great job.
Bye.
Good job, y'all.
Thank you.
Bye, guys.
Bye.
Bye.
Aw, thank y'all so much. And I love the changes that y'all put in the slide, seeing where people are
Thank
colored.
you.
I'm glad.
Yeah, and I know Dr. Chavez had mentioned it, and I know that's not intentional. Sometimes it's just, that's what we're in, a system that's very white perspective with the lens that we have, and so it's hard to find people of color, but especially with the youth, we like to inspire them and see you can be a nurse or a doctor or just help it to be relatable. So I really appreciate y'all doing it.
Yeah, definitely. It's very encouraging to like see that that relatedness. So definitely.
Yeah, I thought the video was great, and I
Great.
especially like that the doctor was a female of color. Like, that was just perfect. Right?
Yeah, thank you. And at least, let's see, we had 3 youth on there, Reverend Horton. Was that 3? And one of them is wanting to go on to be, she hasn't decided a physician or a nurse. I'm trying to pull her to nursing.
Oh yeah, nursing. Yeah.
So I've noticed her and her sister have been on here pretty regularly, and so, but they're both interested in the field of medicine. Yeah.
That's awesome.
Okay, well, y'all have a good rest of y'all's
wonderful.
day.
Thank you so much.
Thank you.
Bye.
Well,
Oh, really
thank
quickly.
you.
Also on that note, Dr. Chavez, the slides that we had sent you weren't like our final copy.
Okay.
And so I can send you the final copy that was
Okay.
all of the ones from today.
Okay, yeah, go ahead and send me the final, and
Okay.
I'll pass those along.
Awesome. Thank you so
Bye.
much.
Thank you.
Bye.
Thanks, y'all.
Thanks.